If you are trying to conceive naturally and are looking for tips and tricks to speed up the process, you've come to the right place. I'm fertility expert Dr. Randy Morris. Today, I am going to tell you how to time intercourse to maximize your chances for success. You will also learn about the impact of sexual frequency and whether you can use vaginal lubricants. Watch this video to learn about sexual position and its impact on trying to conceive. Outside of the body, sperm don't live very long. Inside of a woman's reproductive organs, however, sperm can live for several days. This means that there are several days during the month when sex can produce a pregnancy. To maximize the chances for a pregnancy, you should have sex before ovulation or on the day of ovulation. How do I know this? Several years ago, scientists studied 221 healthy women who were trying to get pregnant. They kept a diary of each time they had intercourse, and the scientists used hormone tests to determine the exact day of ovulation. By the end of the study, they recorded data on 192 pregnancies. Here is what we learned from that study. The fertility window is 6 days long. In every cycle in which conception occurred, couples had intercourse at least once during this 6-day window. The earliest pregnancies were conceived with intercourse 5 days before the day of ovulation. The latest pregnancies occurred when intercourse happened on the day of ovulation. There were no pregnancies conceived when intercourse only happened earlier or later than that window. This means that if you only have intercourse 1 week or more before ovulation, or a day or more after ovulation, your chances for pregnancy are slim to none. Within that fertile window, if you have sex closer to the time of ovulation, the chances for conceiving are higher. Intercourse on the first day of the 6-day window gives you about an 8% chance for pregnancy. On the last day of the fertile window, which is the day of ovulation, the probability for pregnancy is about 36%. Statistically, those last 3 days of that fertile window give roughly the same chances for success and are much better than the first 3 days. We'll call those last 3 days the peak fertility window. How frequently should you have sex? The data says it doesn't matter. Couples who reported more sex during the fertile window did not have any more pregnancies than couples who had sex less frequently or couples who had intercourse only once. Getting pregnant is not about how often you have sex, it's about when you have sex. As long as you have sex at least once during the peak fertility window, you will maximize your chances for pregnancy during that month. If you don't know when you ovulate, having sex more frequently can increase the chances that you will hit the peak fertility window. Does this mean you need to have sex every day? No. If you have sex every other day, or even every third day, you will still be guaranteed to hit that peak fertility window at least once. What about lubricants? If you use lubricants, you are not alone. One study found that nearly 30% of couples attempting to conceive reported the occasional use of lubricants during intercourse, and 14% reported frequent use. There has been concern about the use of lubricants in couples trying to conceive, since some studies done in the laboratory have suggested that some lubricants may adversely affect the movement of sperm. Sperm movement under a microscope doesn't necessarily predict what will happen in real-life conditions when couples are trying to have intercourse to conceive. This 2012 study looked at 300 couples who were attempting pregnancy. They compared couples who used a lubricant during the fertile window to those who didn't. The study did not find any difference in how long it took couples to get pregnant, whether they were using a vaginal lubricant or not. This study was too small to compare different types of lubricants. In 2018, a much larger study looked at 6,500 women who were trying to conceive. This study was large enough to look at the effect of different types of lubricants, which they divided into 4 groups: water-based with pH balance or not, oil-based, and silicone-based. These groups included all of the commonly marketed brands of lubricants like Pre-Seed, KY, and Astroglide, as well as improvised lubricants like baby oil, olive oil, or vegetable oil. The results of this study confirmed the results of the earlier study. Lubricant users took the same amount of time to become pregnant as non-lubricant users. It did not matter what type of lubricant was used. Couples who used lubricants that slowed sperm movement under the microscope still got pregnant as quickly as non-users. Specifically, lubricants that were marketed as being fertility-friendly had no benefit over other lubricants. Our Infertility TV bottom line is this: it is possible to get pregnant over a 6-day window. Your best chance to conceive a pregnancy is when you have intercourse either 2 days before ovulation, 1 day before ovulation, or on the day of ovulation. The frequency of intercourse does not matter as long as you hit one of those 3 days. If you suffer from vaginal dryness during intercourse, don't worry. You can use a vaginal lubricant without affecting your chance for pregnancy. Any type of lubricant will work. You don't need to pay extra to use a special fertility-friendly brand. Thanks for watching. Check out this playlist with dozens of tips and tricks for getting pregnant faster. You paid a lot of money for this phone. Put it to work for you. Subscribe to Infertility TV now and tap the notifications bell so you know the second a new video is published.